My name is Gage. I'm a physical therapist in Los Angeles, California. I graduated from USC's PT program in 2019 and then completed the orthopedic residency at USC the following year. I currently work in outpatient orthopedics. I was exposed to the NecksLevel right at the beginning the beginning of the COVID pandemic. The NecksLevel device is well suited for orthopedics, specifically with the rise of a desk working posture, with more people working from home and not able to control their ergonomic setup as much. I think it has a huge place in helping those patients. At first, I thought, it was a really, simplistic design. And, there's a certain elegance in that where there's not too much fumbling around. The ease of use really allows you to kind of set the patient up and then gain that independence so you can move on and either see other patients or prioritize different things in your treatment session that might require a little more one-on-one attention. The clinicians that I work with were pretty excited about the device. It kind of, filled a gap where, it's not that we're a fast-paced clinic, but we don't always have time to go over movement interventions with our patients. So there was this concern of like, oh man, are the aides going to be able to, teach this person this like kind of intricate cervical exercise? And the NecksLevel just plugged right into that scenario. So it kind of allows us to extend like the high quality treatment that the patient is getting. I probably got the best results from those who are dealing with muscle or myofascial related pain in the neck, and using a isometric protocol, they were able to get some relief from their symptoms, which was really huge for them and kind of, create a more buy-in to PT. And then from there, I would typically go to that hold and then an eccentric contraction, and then I'd help them reposition manually. And then after that point, it's like off to the races with concentric, like longer eccentric contractions, and then increasing the load from the device. And I think another, avenue that we're getting more towards with patients as, like surgeries open up following the pandemic is the post-op rehab following any neck surgery has been really helpful using the NecksLevel. Those patients are seeing a lot of benefit out of that. I think the NecksLevel is going to be one of those things where word of mouth is going to drive some people to come and use it. People with neck pain who've been dealing with it for years and see that like really rapid result from having a good targeted strengthening protocol designed for them are going to be talking about that to their friends who they might know or people in their office who are dealing with neck pain. Anyone who's interested in purchasing the NecksLevel to consider it like a very long-term investment. We haven't had any difficulties with it mechanically. It's been sound and like is used consistently throughout the day, every day. It's something that, really bridges the gap from a patient who's more acute and more irritable to a person that you want to start returning to sport. And that's something that I think has been missing in cervical spine care, at least in the setting that I work at, where it's not necessarily the highest level of athletes, but we need to have those people have strong necks.